If there's a point of pride here, it's that we have now earned the right to be spoken in the same sentence as the Hopkins, the Cleveland Clinic, Mayo Clinic, MD Anderson, Mass General.
And rightfully so. The University of Kansas Health System will be the first in the region to provide proton therapy. This type of therapy allows for more pinpointed treatment for cancer patients.
Proton therapy is one of the most advanced forms of radiation therapy for cancer patients.
But until now, not easy for patients in the Kansas City metro or Midwest region to access. Currently, there are only 29 proton therapy centers nationwide.
There are times when patients have to leave Kansas City for some of the most advanced treatments, such as Proton. We don't want that to happen. We believe that with this announcement today, we can keep even more patients here in Kansas City closer to home as they receive care.
Proton therapy is a pencil-sized beam that differs from regular radiation treatment by killing the cancer without harming nearby healthy tissue.
This type of particle, which is a proton particle, part of the nucleus, is delivered to the patient, and then when it hits the cancer, all of its energy is dissipated in killing that cancer. Other types of radiation then go on beyond that cancer and can cause damage in normal tissue.
Proton therapy is FDA approved and covered by Medicare, Medicaid, and most insurance companies. More important, research has demonstrated its effectiveness with minimal side effects. Plus, proton therapy has been shown to lower the risk of secondary cancers in patients. In 18 to 24 months, this new technology will be available here for both adult and pediatric patients.
In pediatric cancer, we've made incredible progress against this disease. Back in the 1960s, maybe 10% of kids survived pediatric cancer. Now it's well over 80%, and depending on the type of cancer, it's over 90%.
Hospital leaders say bringing proton therapy to the University of Kansas Health System represents a multi-million-dollar commitment to this region, guided by a singular focus.
Put the patient in the center of your decision-making. Put all your efforts around what's the right thing to do for the patients. Put the technology around it. You put the resources around that. This is just another step in that process.
The process of changing how healthcare is delivered today and in the future.